Hello, everyone. Thank you for clicking on our presentation. Today, we are going to be discussing rural educational leaders' perceptions on mental health programs for adolescent students impacted by opioid misuse. My name is Emma Harder. I am also going to be presenting with Casey Karsten and Dr. Hess. We are part of the Patton College of Education and Conavino Honors Program. Casey, you can go ahead.
So our research came into fruition as a result of our work with the Conavino Honors Program, where we were introduced to a lot of research regarding rural American Midwest and the opioid epidemic. However, we noticed there were a lot of gaps in the literature regarding how schools specifically were responding to the opioid epidemic. So we know that rates of opioid abuse are rising each year, and with that, more children are living with individuals suffering from opioid misuse disorders. We also know that schools have a large impact on schools' mental health and development, on children's mental health and development. So we want to investigate what roles, if any, schools are fulfilling to help their students cope in an environment where it's becoming increasingly more entwined with the opioid epidemic.
The primary work of the team is to better understand how rural educational leaders, especially in rural Appalachian Ohio, perceive the role of mental health programs when combating the effects of the opioid crisis on their students. The Appalachian Ohio is 32 counties. We looked at the counties with the highest opioid overdose rate based on the Ohio Department of Health's data, and that's where we pulled our participants from. To date, we have 6 qualitative interviews completed with licensed educational leaders that for us include superintendents, principals, teachers, and counselors. And all of these are from rural districts in southeastern Ohio in the Appalachian area. So the interviews have been recorded in a Zoom format. We've done verbatim transcriptions and using MaxQDA software to do our initial coding and analysis. The length of the interviews have ranged between 45 minutes to an hour. And the data collection is continuing. This is a presentation of our preliminary findings from the 6 interviews we've conducted so far.
Yes, so through the interviews that we have completed thus far, we've analyzed 3 prominent themes, all of which are listed on the 2nd and 3rd column. I'm going to swiftly run through them today, but it's important to note that we've provided merging quotes for each of these themes, and they all come from our interview pool. These quotes really provided the framework from which we pulled out these themes. So the first theme that we're going to discuss is the intersection of rural schools and community resources. So as funding is limited in these rural schools or stripped completely, many schools have had to turn to local resources such as health recovery services or sheriff's departments to really bridge that gap in the lack of resources provided for students. One rural superintendent discussed the importance of actually providing a safe space within the classroom or an extra building, whatnot, for these resources to come into the school district and actually set up shop. So through the inclusion of these resources, schools are able to provide the best well-rounded education they can for their students. Going along with this notion, another prominent theme was the role of trauma-informed care when providing a safe space for students to thrive. It's critical for teachers to have that training in detecting signs and symptoms of distress, because if teachers are unable to detect the signs, a lot of times they're unable to provide the resources students need to succeed academically, socially, but more importantly, emotionally. If we want to find that academic success, we must address the emotional turbulence first. And so then lastly, mental health programs have really become a critical step in creating a safe space for students to work through real life scenarios such as opioid misuse. So the programs at rural schools might look different in how they're structured and what resources they bring in, but the essence behind each of these programs is to provide a space for students and a support system for students to turn to in times of distress. So if students can identify at least one role model or ally within their school building they are much more likely to have a positive educational experience because they're able to search out the resources they need and they have these allies already established. Overall, these programs have positively affected school culture and should be seen as a step forward for rural school districts looking to address opioid misuse and, more importantly, trauma in their general school population.
So concluding our research, we found that a lot of these programs suffer from inadequate funding, resulting in the school's inability to provide high quality care that they desired. And many of these schools have resorted to using local resources to bridge any of these gaps and expand their services. As for the future of our research, we plan to continue interviewing until we've amassed sufficient data where we will then have compiled a variety of effective strategies that other rural school districts can adopt and implement.
Yes, so thank you for clicking on to our presentation today, and feel free to reach out if you have any additional questions.